Hello, and welcome to the Center for Global Development's 7th annual Birdsall House Conference on Women. I'm Amanda Glassman. I'm the Executive Vice President and a Senior Fellow here at CGD. This series of conferences, named after CGD's founding president and amazing woman leader, Nancy Birdsall, began with the goal of highlighting leading economic research on women's empowerment in the field of development economics. Past conferences have focused on how to measure women's economic empowerment, the role of contraception in increasing women's economic aspirations and opportunities, and the potential for childcare solutions to benefit children and their caregivers alike. The theme for this year's conference, of course, centers on COVID-19. Not a surprise, but also COVID-19 as a gendered crisis. Through CGD's COVID-19 Gender and Development Initiative, a team of researchers has worked together for over a year to explore how the pandemic is affecting pre-existing gender inequalities, to analyze the extent to which donor institutions and policymakers have considered these issues as part of their response, and to identify what else is needed to ensure that women and girls in low-income settings are not left behind in the COVID recovery effort. What have they found? So first, women and girls have indeed been hard hit, both economically and socially. Evidence from over 100 countries points to outsized employment and income losses for women, higher rates of profit loss and closure for women-owned businesses, and increased care burdens borne disproportionately by women and girls, as well as increases in gender-based violence. Governments and donors have recognized these efforts. They have these issues and have made an attempt to address these gendered impacts, but there's more to do. The team did a really interesting analysis looking at project documents from the multilateral development banks, World Bank, ADB, and the African Development Bank, and found that about 86% of projects dealing with economic recovery, 81% of projects with social protection elements, and only 51% of projects that dealt with the indirect health impacts of the pandemic included gender-specific indicators or targets, and yet there was a huge impact on non-COVID related health services directed to women and girls. And it's still unclear at this stage whether this focus on gender and results frameworks actually translates into equitable impact on women and girls. Third, investments in cash, care, and data can help support a more inclusive recovery. Examining both COVID-specific and pre-COVID evidence on what works to promote women's economic empowerment and broader gender equality, led by Myra and Megan. The team's research really highlights a need to increase investment in these areas. Care is about the investments that reduce and redistribute women's unpaid care work. Cash referring to cash transfers to vulnerable populations and women in particular, as well as broader support to women-owned firms and sectors where women predominate. And finally, data referring to integrating a gender lens into monitoring the impact of COVID response measures, as well as broader data systems. I think the team's findings underscore that gender inequalities that we've witnessed during COVID, whether manifested as a shadow pandemic of gender-based violence or a surge in unpaid care work, are magnifications of long-standing inequalities that stall inclusive development in general and make it all the more important to keep up the momentum on this agenda in the longer term. Through today's conference, we'll hear from a really impressive group of researchers, advocates, donor and MDB representatives, all of whom will discuss the latest evidence on COVID's gendered impact and contribute to proposing and enacting a shared agenda for an inclusive recovery. And I'll now pass the mic to Greta Schuttler from the Bill and Melinda Gates Foundation, who has played a really important role in financing the whole ecosystem, really, of organizations that are working on these issues. Thanks so much, Greta.
Thank you, Amanda, and to the whole CGD team for your thought, leadership, and incredible collaboration. On behalf of the Bill and Melinda Gates Foundation, it is my honor to participate in the 7th annual Birdsall House Conference. As Amanda noted, the COVID-19 pandemic has laid bare existing economic inequalities that disproportionately impact marginalized groups, especially women, with the World Bank estimating that 55 to 63 million people could be pushed into extreme poverty within IDA countries alone. To make matters worse, according to the World Economic Forum, globally, gender parity has been set back by a generation. It will now take a minimum of 135.6 years to close the global gender gap, up from 99.5 years before the pandemic, which was still greatly concerning. If economic recovery is going to be dynamic and durable, it will require concerted efforts to reach marginalized populations who have been hit hardest. The percentages that Amanda shared just now, that only 81% of projects with social protection elements and only 51% of projects dealing with indirect health impacts of the pandemic included gender-specific indicators or targets, is always frustrating to hear, especially when the evidence for being gender intentional seems to become increasingly clearer. But as many of us know, the lack of inclusion is often not by intention, but rather a lack of awareness, a lack of expertise, a lack of funding, pressure to move quickly on projects, a lack of the right oversight, a lack of knowing what to prioritize, and a long list of other lacks that potentially could be mitigated. So where do we dig in first? What's exciting about this conference is this community. It is the big ideas, the insights into why efforts usually fall short, and the opportunities to share thoughts on how we can collaborate to bring solutions to the table. Cash, care, and data are three areas that, if integrated effectively into crisis response efforts, could truly help to restore growth for all. At the Foundation, we are eager to be a part of supporting these efforts. We started by focusing in on care, an area that has so much opportunity for growth and exploration. As a result, the Foundation is partnering with the World Bank and contributing $10 million towards an incentive fund to support LMIC borrowers to develop, integrate, and scale gender-intentional childcare models. Now, how do we capitalize on the fund and crowd in other potential donors? On cash, much is already being done, especially on government-to-people payments, but we are eager to lean in with the global community to catalyze lessons learned. For example, as of July, 200 countries and territories had expanded or introduced social protection measures in response to COVID-19, which is more than a four-fold increase, resulting in 915 million new beneficiaries. So how do we work together to turn lessons learned from a temporary measure into healthy new norms that enable more people to be reached and thrive? And finally, on data, the Foundation has been working with data partners to understand how the pandemic has affected women specifically. Now, with a clearer need for gender data to better design policies and programs, how do we continue to incentivize domestic and external investments in data systems that prioritize gender-sensitive data? How do we take advantage of what we have learned to ensure more and better data are asked for, used, and funded? In the end, it is questions like these that we are eager to explore with this community to ultimately support a more gender-inclusive recovery. Thank you again, CGD, for hosting this conference, and we look forward to being a part of today's discussion. Now I'll pass it over to Shelby Bergo to lead our first discussion on data. Thank you.
Hi, Greta. Thanks so much. All right, let me get our slides up. All right, so working through CGD's Gender and Development Initiative and in partnership with Emerge out of the University of California, San Diego, we have synthesized evidence from over 100 countries on the gendered impacts of COVID-19. Today, I will be presenting the findings from our latest literature review covering 36 papers from 21 countries on the crisis's gendered social and economic impacts. 58% of these papers review the impacts to women's employment and entrepreneurship. And the findings of these papers overwhelmingly support earlier analysis showing that women have faced disproportionate job losses and losses in wages. For example, a study in South Africa shows that women accounted for 60% of jobs lost, and estimates in Chad show that 61% of women have lost wages during the pandemic. New evidence also shows that informal workers have been particularly hard hit, with informally employed women in Peru 10% more likely to lose their jobs than informally employed men. Earlier analysis also showed that women-owned businesses were more vulnerable to profit loss and closure, and a new paper across South Asia shows that women's businesses closed at a rate of 50% compared to men's at 39%. 17% of the papers in our sample focus on agriculture and food insecurity. Model simulations in Chad show that women farmers may be shifting away from cash crops and subsistence agriculture in favor of livestock production, which is less vulnerable to input price shocks. Research in Myanmar shows that women farm laborers are having a more difficult time finding wage work as compared to before the pandemic. Little new evidence, though, has come up on food insecurity, especially at the individual level. Studies in Senegal and Sri Lanka point to increases in household level food insecurity, but more work needs to be done to determine whether the pandemic has disproportionately impacted women and girls. We find 33% of the papers document how care work has shifted and impacted women during the pandemic. New evidence shows that women's care work burdens have increased both relative to before the pandemic and in relation to men. For example, in Ghana, women are spending an additional 1.5 hours per day on domestic work. And in South Africa, women are spending an additional 4 hours a day on childcare. We also find a growing body of evidence on women working from home and balancing care responsibilities. Papers from Bangladesh, India, Brazil, Ghana, Turkey, Pakistan, and Vietnam document these challenges and the ways women are adapting, often by decreasing paid work hours to accommodate more hours spent on care work. While these papers deal with a relatively privileged subset of the working population, they highlight that even in higher income households, women's attachment to the labor market is more vulnerable to increased demands for care work. 17% of the papers included in this review look at gender-based violence. This adds to the sizable evidence collected through our collaboration with Amber Peterman, showing that violence has increased against women around the world, largely due to increased economic insecurity and lockdown measures, which are keeping abusers and victims at home together. We find papers to corroborate this increase in Bangladesh, Peru, and Zimbabwe, and find that women from rural areas with low levels of education, informal workers, and those in arranged marriages may be among the most vulnerable. Finally, only 8% of papers analyze government's policy response to COVID-19 from a gender lens. The first focuses on policy response measures related to GBV in Europe and documents which countries implemented prevention and response measures, but stops short of analyzing effectiveness. A study across South Asia finds that women-owned businesses were half as likely to access public support in comparison to men-owned businesses. And qualitative research from Nigeria shows that women informal workers were largely unable to enroll in food vendor programs meant to ensure continued income generation. Taken together, these papers suggest the limitations of policies in responding to pre-existing gender inequalities and ensuring equitable access to relief mechanisms. So where do we go from here? This review largely confirms previous findings. It's increasingly well established that women have borne a disproportionate social and economic impact. And now more research needs to be done on the gendered impacts of policy response measures. What is working to promote a more inclusive recovery? What has helped keep women out of poverty and food insecurity? And what has worked to prevent violence? We need to answer these questions in order to ensure a more equitable recovery moving forward. And with that, I will turn it over to Charles Kenny for our first panel discussion.
Hi. Thanks, it's a delight to be here. I'm Charles Kenny, a senior fellow at CGD. I have a fantastic panel, Isadora Kay, who is the Gender in Emergencies Coordinator at CARE, Amy Oyakunle, who is lead consultant at Moni Development Consult, Karen Garcia Rajas, who is head of the Differential and Intersectional Statistics Unit at DANE, and Ben Leo, who is CEO and co-founder of Frame and a CGD alum. Great to see you back. I don't want to take any more time with introductions and just get straight into the panel session. And I think we should start. Karen, Your research in Colombia describes what's happening with a staircase fall in employment from sort of formal to informal to unemployment. Could you sort of outline that story, and do you think it applies more widely beyond Colombia?
Thank you very much, Charles, and thank you all for this invitation. Yes, of course, we think this crisis gender effects are very similar globally, mainly because two elements: the care burden, given the pre-existing strong sexual division of labor, and the fact that the lockdowns affected mainly economic sectors that are intensive in personal contact. This, of course, applied in Colombia, in all Latin America and the Caribbean, and globally. I think most affected women are those in feminized sectors, precisely, and this is also true globally, and those with high level of care responsibilities in a context where the care services outside households didn't recover fast. This is true in Colombia. In Colombia, we're still having more than a half of children studying from home. And this, of course, make difficult the recovery of women employment and of their available time to work for a payment. And there is a fact that we also have studied here in the National Statistical Office, and is that men adjusted via decreases in wages level and in hours available to paid work, but women just were expelled from employment in average. So in summary, men didn't lose all the benefits of half unemployment, but women, in fact, due to a stair fall, lost their bargaining power and the benefits that are gained for having a paid work. Also, this crisis is unique because reactivation was really slow in feminized sectors, as I mentioned, especially in the sectors intensive in care, and this affects women twice as much. Thank you.
Karen, you mentioned you might want to share slides. Is now a good moment to do that, or?
Well, if you want me to cope with the question about informality labor, and maybe I could share.
Sure, do go ahead.
Okay. Well, in fact, I would like to share. I'm not going to share the results of the paper, because I think maybe you could find this in the paper, but I just wanted to share this this index. I'm sorry, it is in Spanish. Here we have an index constructed on the base of the level of employment in January of 2020. And by the last available month with information, September of this year, we just have the level of employment of men fully recovered, 100% of the employment of the January, with no stationality in the series. We have corrected this stationality in the series, but we have just 93% of the level of employment comparing September of 2021 with January 2020. And this is just the summary of how slow have been the recovery of employment in women. And also talking about informality, we know that men are recovering both informal and informal sectors. As you can see here, these are numbers in miles. I'm sorry, I forget the word. And we have that men are just recovering informal and informal sector, but women are mainly recovering their jobs in informal sector. And this is due to the gendered labor market structure, because women have an important participation in informal occupations, like, for example, domestic employment, like maids here in Colombia are like 7% of the total employment. And this, I think this is very special in countries in Latin America and the Caribbean. Maybe this is different in the North, but this is the case talking about informality. Thank you.
Fascinating. Thank you. It's depressing but fascinating data. And sort of on that data topic, Amy, you've been sort of conducting research on the gendered impact of COVID in Nigeria, but also sort of actually on the front lines of sort of community response. I'd be interested in sort of how much does the data and the reality you're seeing match up?
Thank you, Charles. It depends on the data we're talking about. So when you talk about data and COVID-19, what we see is we'll see a lot of health statistics. So on the Nigerian Center for Disease Control, NCDC website, we have the statistics of number of cases, number of those deaths, and number of those that have been released. It's not disaggregated, at least not on the website. But what we are seeing, according to the Global Health 50/50, we're seeing that more men have a higher infection rate, 60% vis-a-vis 40. What we are not seeing is how, in terms of testing, do women have access to even going to the hospitals, to the PHCs to get tested? Do they have finances to be able to go? Do they make that decision to go and get tested? Can they make that choice or that opportunity to say, I'm not feeling very well, let me not take care of my children, or who takes care of my children, let me go and get tested. So that information is not coming out in the data. But having said that, the data is important in terms of the health data. What I saw in our research is that the data doesn't show the true picture of the disruptions that the pandemic had in the lives of women, in the lives of girls, in the lives of men and boys, particularly when we talk about the marginalized and vulnerable group. What I saw was that women who represent about in Nigeria, a very high proportion in the informal market, in the informal economy. So women are housemaids, they sell in the open market, they sell perishable foods. When we had the pandemic and the lockdown and policies that eventually came without a safety net, a lot of women were affected in peculiar ways. As someone mentioned, the way they had it hit, a lot of women suffered huge losses. A lot of women are yet to cope with the effect that it had on their capital. Many of them had to take out loans to begin with to be able to invest in their business. And when I say loans, it's $150, Charles. It's little money compared to what we are used to. But for many of those women, these were loans that they were supposed to pay back. And because of that, they had to default, which has had a knock-on effect, and they are yet to recover even as we speak today. When we see the impact, the gendered impact, we see that a lot of women who occupy the lower cadre of the health sector, women who are nurses, midwives, cleaners, workers in the health sectors, had to go through stigma while they were working as healthcare workers in providing care. And even though it was, we all clapped for them and we all admired what they did during the pandemic, it was heroic. A lot of them had to deal with the trauma of not seeing their families, of having to be kept away from their families, of having to provide informal health advice for family members who refused to come to the primary healthcare center because they had the perception that if I come to the health center, I would be infected with COVID-19. And many of them are yet to recover, are yet to have some sort of mental health talk or an opportunity to rest, as women would do. Finally, what we're seeing is that in terms of the division of labor, it changed. It changed during the pandemic. Did it change for the better, Charles? I don't know. In truth, a lot of women were kept in the houses with their spouses. And Nigeria is a very patriarchal society. So while we're locked in the houses with our husbands or our partners or our mates, it didn't necessarily translate to them having an equal share of the housework. So many women still had to do childcare. They had to combine childcare with work. I had situations whereby women said they are on a Zoom meeting and they have to deal with a baby crying, or because unfortunately for some of them, they didn't have their normal services, which was a daycare center or a maid who happened to be affected by the pandemic. Now, many of them are having to go back to work and having to cope with that burnout that led to anxiety and depression. Again, all of that is part of the gendered impact. Data doesn't show that. It shows the economics, it shows the finance, it shows the amount of money government spent, government is intending to spend, government borrowed, government is intending to borrow. But how do we quantify that in terms of some of these social indicators that are critical and important in the lives of men and women, but more so for women based on our culture? So that's what we are seeing in terms of our data. I should say one more point. The government did have a lot of support, palliatives. And when we talk about palliatives, they were giving out foodstuffs. There was cash transfer in some cases. But what we also did see was that they were insufficient in terms of what those palliatives were. Some people received as little as a tube of yam or spaghetti, just one spaghetti for a family of 5 or more. And sometimes it didn't reach the most vulnerable or the most marginalized groups. In a research that we did in Benue, Nasarawa and Plateau, somewhere in the Northeast, a lot of women complained of not seeing just one palliative, they didn't get it. And in most cases, in terms of the government survival fund, where they were supposed to give money to informal business women, we couldn't find, women said they've submitted their names for over 6 months and they're yet to receive a call from someone saying, this is what we're giving you. So the data doesn't show that, and we're hoping that with this research, it will bring it out. Thank you, Charles.
Thank you, Amy. That's depressing, but links very well to the question I wanted to ask Isadora. You're working a lot on the traditionally marginalized populations and capturing their experiences during the pandemic. And I was wondering if you could talk a little bit about, data particularly for these most vulnerable groups and CARE's rapid gender analysis.
Thank you very much, and hello everyone. What we're seeing around the world is actually echoed in many of the humanitarian emergencies that we're working in. And rapid gender analysis is a piece of work that we do specifically at subnational level for humanitarian response. And unusually, actually, COVID has been one of those moments where what's happening around the world is also being echoed and paralleled in humanitarian responses around the world as well. So many of the issues that we saw in the 54 rapid gender analyses we did last year and the 25 we've done this year have been very similar to the ones that Shelby and Greta raised earlier and that Karen and Amy have eloquently spoken about. We're seeing issues around food insecurity and livelihoods. We're seeing women working in the informal sector much more so than men. So with one survey we looked at found that 55% of women reported having issues around livelihood and struggling to make ends meet because they work in the informal sector, compared to about a third of men. And the same with food security as well. We saw significant differences in how often women are eating compared to men, with men tending to eat a bit more than women generally, and children as well. So there are those issues. The mental health issue is a huge issue that's been reported from humanitarian crises around the world. Again, an issue that comes up, but came up consistently with COVID. The specificity facing humanitarian crises is really that triple burden, if you will, that triple crisis of COVID, climate, and conflict. Right now, today, we're doing rapid gender analysis in places like Afghanistan, in Haiti, in Ethiopia, in Sudan, in Nigeria, actually. And in these places, there are competing issues happening and affecting people's day-to-day life. It's not just COVID. The second point I'd make is women told us pretty early on, women from marginalized communities were able to tell us pretty early on messages that we weren't quite ready to hear at the beginning of the crisis. So we believed that this was going to be a health issue. We focused our attention as a global humanitarian community on health issues. But actually what women were saying pretty quickly was, I've lost my job. I haven't got anything to eat. I'm scared. Domestic violence is raising. And that wasn't just in humanitarian emergencies, that was around the world. But I just wanted to echo that complexity, that we assumed it would be having a health impact, but pretty quickly women were directly telling us, and we polled 6,600 of them, and many more through our rapid gender analysis surveys in countries, that it was more day-to-day kind of quotidian issues that were facing them and that were really at the forefront of their minds. Issues around domestic violence have continued to be huge around the world. So that's definitely been a big issue. And the lack of women's participation in decision-making is a particular issue in humanitarian emergencies. So there definitely are specific issues facing women in humanitarian emergencies. I would actually frame the question slightly different. It's not just a data gap, it's an analysis gap. It's great. Amy talked about this. We can have a lot of data, and I'm excited to hear Ben's presentation on this too. We can have data, but unless we can contextualize and understand what that data is telling us, and even more importantly, what we should do about it and how we put those findings into action, we really won't be moving forward. So really, that would be something that I would like to perhaps push some of the discussions today on. Gender data is fantastic. In some ways, sometimes I feel I'm swimming in data. We have a lot of it. We've got new work on big data. We've got digital data collection that's helping us connect over the phone. I can literally call and do an interview with somebody in Diffa in Niger, and have that data come and text to. It's incredible what we can do with some of these digital solutions. But unless we can understand and have that local knowledge, we're not really going to be able to know what does it really mean? What should we do about that? And those are some of the changes we've seen more and more with COVID, actually, has been that more and more the people doing rapid gender analysis are based in the countries in which they lived, are working at that subnational level, and are truly localized. And those are some of the issues I think we should also be talking about.
Great. I want to come back to the question of what do we do with all this data, and what policy responses is it pointing to? But just before we get there, I do want to ask Ben. Local data in particular is still lacking a lot of places, as we've heard. Frame is taking a sort of a non-traditional approach, if you will, to collecting this data. Do you want to sort of fill us in on some of that story?
I would absolutely love to, and it's wonderful to be with all of you, and in a lot of ways be back home at CGD after a number of years being away. Thank you for having me. So our mission at Frame is to map humanity and revolutionize data-driven decision-making. And for us, what that means is being able to map and produce actionable data about what communities look like, how they behave, and what they might think about a range of different issues. And the way that we do that is we take geotagged household surveys and combine that data with several hundred types of satellite imagery and remote sense data to produce literally hundreds of population-centric indicators about what communities look like across the country, a region, and a continent. And we've been thrilled to work with our partners at the Gates Foundation to target this kind of transformative technology to better understanding some of the gendered impacts of the pandemic, socially, economically, as well as on the personal security side. So we surveyed 50,000 people in India, Kenya, and South Africa looking at these kinds of issues, and produced these spatial maps down to a 1 square kilometer resolution. You can aggregate that data up to official regions or whatever unit of analysis might be actionable for a stakeholder. And there's a couple of things I could talk at length about, some of the data and the insights and things like that. Folks can go get those reports. We produce 6 reports that are freely available on our website. You can swim around in the data, and if you have any questions, reach out to me directly. But there's 3 things that I would just generally mention on takeaways from these three countries where we really dug in on both macro and also micro trends, and they dovetail with what we heard. But there's a slightly different nuance to it, or additive flavor from what folks said before. Three things. One, what we saw is that women self-report spending more time on caregiving, household activities at statistically significantly higher rates than men. So we heard about that. The second and third, I think, are a little bit of an added context. The second high-level takeaway, and these trends hold across space as well. These are issues that we find prevalent across the countries when we look community by community. The second is that strong majorities of both men and women believe that women have been disproportionately impacted when it comes to caregiving responsibilities, to economic or job dislocations because of school closures and other issues, as well as greater exposure to domestic violence in the home. So for instance, in South Africa, South Africans overall are 20 times more likely to state that women have been disproportionately affected by added caretaking responsibilities or caregiving responsibilities. 15 times more likely to say that women are disproportionately exposed to domestic violence inside the home. So those are really, really striking recognitions that hold across men and women on the gendered effects of the pandemic. The third thing that I would mention is that we find very, very, very high levels of public awareness and support for government programs or interventions that were intended to address some of these issues. That doesn't state whether they were sufficient interventions, as we heard before and Amy touched on in Nigeria. Putting that aside, but there is a very strong awareness and support for some of these programs, whether we're talking about the Child Support Grant in South Africa, or some financial inclusion schemes, or rural employment guarantee schemes in India that we looked at. Across the board, 70, 80+% of respondents are aware and favorable towards these, which becomes very actionable when you think of what next. How do we actually do this and drive the needle? There's a lot of support for it, and there's a lot of recognition for the need, which I think is an important enabler for policymakers.
I want to come back to Isidora's question, Ben, but stick with you just for a minute. You've also been running some sort of simulations on understanding the impact of policy responses. What do they say? So
this is actually, I can see why you went to this, Charles, because it is a nice segue on some of the really important things that Isidora mentioned and pushing us all towards action. So what we did is looked at the body of studies that are out there from programs that have been executed in 10, 15 countries over time, focused on some of the issues that really pop in the surveys and some of the issues that our colleagues here were talking about. And so what we did is we did some novel spatial simulations. So if we look at program effect sizes from some of these, what could we expect in an order of magnitude in terms of the potential effects in these countries? So take one in particular. We looked at programs focused on early childcare, and over time, it's different in different places, but you see about, on average, between 8 and 22 percentage point improvement in female employment rates if you have some of these programs. And so we looked at those, and then we applied them spatially in 4 or 5 countries, Uganda, Nigeria, Senegal, South Africa. And what we found in a very, very, very focused rollout, if this kind of program, if this policy was effectively executed, you could, based upon the previous body of peer-reviewed research, see an improvement of up to 2.5 2.4 million women joining or rejoining the workforce with a program like this. And not only is that like a macro finding, but what's particularly novel about it is that we deployed that technology that I was talking about. So you can actually see where there are concentrations of potential beneficiaries at that community, city, if we're talking about Nigeria, state level, LGA level, and be able to have a very, very focused, deliberate, accountable rollout of these programs. So those reports are also totally available on our website. I hope people have a chance to glance at them and get value from them, and reach out if they have any questions or thoughts or improvements. We'd love to iterate with folks and see if we can contribute to some action, as Isadora was talking about previously.
Amy, Ben mentioned Nigeria. I mean, does that sort of fit with the policy implications you're finding what he's suggesting, or does it add, subtract, go 90 degrees?
Oh, that's a good question, Charles. And I would love to get my hands on those reports, Ben. In Nigeria is unique, isn't it? In the sense that, yes, you have the prototype in terms of what works, right? And then in reality, it might not be to type. Let me give you an example. Most of the information that we get in terms of how it informs policy means that there is a body, policymakers, civil society, mostly civil society, but policymakers that recognize and understand what the implications are, but more importantly, have the political will to make many of these pronouncements and have an engaged citizenry that hold them accountable and say, as policyholders, as policymakers, as government, give us, programs and things like that. And time again, we've seen that there's that constant tension between researchers like us and policymakers and what clearly obtains. Having said that, I think that in terms of what is important for all the findings that Isadora spoke about, that Ben is alluding to, is just the inclusion. I would start with the investment in building the capacity of those who are in that space, in that office, to understand, interpret, develop, design, and implement and monitor when we talk about gender responsive, whether it is pandemic plans, pandemic preparedness plans, or even economic plans for building back better and including women. So it does resonate with me as a researcher, but I tend to be optimistic about, pessimistic a little bit about some things when it comes to actual implementation in Nigeria, Charles.
Thank you, and apologies for the siren going off in the background. Isadora, I want to come back to you on your own question, or your own push to us to move towards policy. I mean, if we are in an environment where we know this is a gendered crisis, and when I say we, some of the research Ben was pointing to suggests, we is a large, it's a popular opinion that this has been a gendered crisis. Are we not seeing the policy responses we'd like because it's gender, but as you're mentioning, it's also sort of multidimensional and it brings in climate, it's complex, or is there something else holding this back? And maybe the problem is beyond data.
Sorry, I was just pushing the wrong button, Charles. So yeah, I think some of the things that are most exciting me in the policy space are when we devolve, and some of the opportunities that have actually come up through COVID, as we think about responding to the crisis in Colombia with the Venezuelan refugee crisis, as we think about what's happening in northern Nigeria and across the border in Niger and Differ and Zinda, is really that opportunity to devolve money, power, and decision-making at the most local level. So Well, rapid gender analysis is my first baby. I mean, I created it for the Syria crisis back in 2013. I'm very attached to it. And I urge you to get trained and think about how analysis can help you take data and think about what it means in that context and what you should do about it. That's great. It's really that second piece of work we've been looking at, which is called Women Lead in Emergencies, which is when you put the analysis and the data in the hands of very local groups of women, very, very local groups. So these are not formal women's rights organizations. There is as small as a tontine in Congo. They're very, very localized. It's a project we're running on the border with Nigeria and in Colombia, actually. When you do things like Women Lead in Emergencies, where you put the information and the knowledge and the capacity to make decisions, as well as some budget, in the hands of local women, they do incredible, transformative, subversive things with that money and that power and that decision making, and make huge actions happen that have incredible effects for their community. So really what I'd like to see more of is policymakers supporting and thinking about how you can support and ease up on some of the regulations, perhaps, so we can actually get money to small groups of women and men, but particularly on this case, women's participation is a huge gap that's been noted throughout the COVID response. We can get money into their hands and decision-making in their hands, not mine, not yours, theirs, and they will and have consistently made incredible changes happen in their community, from lobbying to get water points moved, from organizing what's the word I'm looking for? They've organized strikes in Uganda to get World Food Programme to move food distribution points, which were 10 kilometers away, move them closer to the villages in which they were living. They've gone and lobbied local mayors to get gender-based violence patrols to address some of the GBV issues that we've just been talking about. They are making changes happen. So I think sometimes we just need to get out of their way and make sure that they have some of the resources. And that's extremely difficult to do in this policy environment. It is very data driven. It is very much a space where women's voices are incredibly absent most of the time, local women's voices. And I acknowledge speaking on behalf of them reinforces that in some ways, but we in many other spaces allow them and give them the space to talk about this for themselves. But yeah, a lot of the decision making happening for COVID has been completely in the absence of women's voices, especially the most marginalized women, and especially the women who are affected by crisis and conflict as well. Charles, does that answer your question, or does that just pose more questions?
Well, both, but that's great. Thank you. Karen, I also want to come back to you. You're presenting this sort of scary data on the speed of recovery, especially sort of in the informal sector in jobs. What's the gendered policy response to that? I mean, clearly there needs to be one, in that the problem has sort of at the macro average level gone away for men. So there clearly needs to be a gendered response. What does it look like? What does your data tell you?
It's a very, very difficult question for me. I think that the government in Colombia has tried to offer special services to get benefits for women, for example, head of enterprises or head of households. And in fact, the majority of cash transfers are for women head of households. And I think there are possibilities that are documented and practiced all over the world and in our region in order to prioritize women in poverty, for example. But I think the structural problem of segregation of women in more vulnerable economic sectors, for example, is a structural problem that has its roots in, for example, segregation in education too, and sexist paradigms from the beginning of the education life. So I think that the cultural change is going to, and for example, affirmative politics in order to include more women in all careers, and also the improvement of the improvement of availability of special care services are going to be like very, very key points in order to keep going in women inequality of conditions for employment.
Accepting there's clearly more to this problem of our response than just data. I do want to circle back, if you will, in the last 5 minutes to the data point, and in part that's because at least I felt I hope I'm not alone in thinking that there are things that I know now that I certainly didn't know at the start of COVID-19. And I think in part it was a lack of data at the start about how this was going to play out, that it was going to be so much more than a health emergency, for example. Now, obviously, data alone can't sort of predict that, takes at least a theory on top. But I would be intrigued to know, if and when we go through this again, what data would you like to see that we have from the very start and have fairly rapidly from the very start that we didn't this time, in order to craft better gendered responses to a pandemic crisis? This is a question for all of you, but why don't I try and go in sort of reverse order from the way we started? So Ben.
I would love to have, for example, a quality of education and mental health statistics from the beginning. Yes, because well, our service months after the pandemic showed us in Colombia that women consistently reported more effects on mental health. And 1 year after the beginning of the pandemic, we have a strong impacts in education of children in quantity, but we don't have anything in quality of education. And that's very difficult to measure, but I think this could have better guide decision-making, and also the participation of, for example, unions of teachers that didn't want to come back to classes, and those kind of things that really affects especially women and children.
Thank you. Ben, you want to get next?
Yeah, a couple of thoughts. So I'll answer it in a slightly different way, Charles. Instead of what I wish we would have been collecting, and more of what I think how we should be collecting and using data going forward. Amy and Isadora particularly raised some really practical issues about how things are going to get addressed in a highly localized, nuanced, contextual settings, which is incredibly important. And there's always going to be a challenge of combining local with the units and the way that policymakers and stakeholders set directions for resource allocation or different kinds of interventions. And so there's a lot of art in there. But from a higher level, I think what we've seen is that there, in my view, and what we've been hearing from local actors as well, is 4 pieces. One, obviously table stakes, gender segregated, gender sensitive, gender intentional data. So of course. The second piece, which I think is largely missing at a scale, which is geographically actionable. So national data isn't good enough for policymakers. It's directional, but that's it. Like, you can't make real resource allocation decisions or policy interventions with scarce resources in an effective way without geographically actionable data. So that's 2. The third is regular cadence. What we found is that having this kind of data on a quarterly basis is probably about right. Real time, everyone would love it. Quarterly actually is probably about the workflow that most stakeholders would actually be able to get value from. And then the fourth, which is just as important, is democratized access. And how do we actually get this into users in a way that they can use? That's not a new issue. It's been with us a long time. But what is clear is rasterized data in a GIS software program like ArcGIS. That ain't it for most users. And so we need to get data in their hands that they can make decisions off at the right unit, whether we're talking in Nigeria again, of a state, a local government area, a ward, or some kind of polygon, custom geographic area that people are making decisions on. And I think those are the four pieces that are actually doable and we should be doing going forward, because we got a long road ahead of us. This isn't going away.
Sadly not. Isadora?
I mean, as a gender analyst, I'm going to come out on qualitative, but I am going to speak to Ben's point as well, right? So qualitative data, I think, is about to be on the cusp of having a data revolution in terms of its availability. We're working right now with Kobo to integrate their work and our work on qualitative data collection for humanitarian emergencies, which would put a massive amount of qualitative data in the hands of lots of humanitarian actors. So Kobo, for those of you who don't know, collects quantitative data for humanitarian emergencies. It's great, it's free, it's wonderful, I use it, please, it's wonderful. But it doesn't really do a good job on qual. In fact, it doesn't collect qualitative data. Gender emergencies and gender issues that Amy's touched on, Karen's issue, Ben's talking about you really need the why, the qualitative piece too. And I think the availability of qualitative data is about to have an explosion. The piece we don't have, and we do have some great tools for collecting more and more qualitative data. So that bit where we hear the voices of people and what they say and why they think it and why it's important to them I think we're going to have an explosion of data. I'm certainly seeing that within CARES data sets. We don't yet have the tools to analyze that at speed, right? So I don't have time in an emergency to wait for someone to in vivo code all of the data coming in. So that's a challenge. I think that's going to be the second point. What do we do with all this qualitative data once we've got it in a way that's manageable and usable and translated and available? So that's probably the flip side of that. And the second point I'd say is governance. We've talked a little bit, and Ben talked about how do you link what's happening at the grassroots local level with what's happening in policy and governance decisions. And from where I sit, there's very much this opportunity to put especially marginalized women, but others as well, on a governance ladder, if you will, on a pathway towards more engagement in governance. And what we're seeing in the humanitarian space is it's possible to do it in the most difficult, dangerous contexts in the world, where you can, and women are, working together to make policy changes at a very local level. And what they're asking us for is a pathway so they can start actively engaging more in some of those policy spaces. So I think if there's some way to connect those different pieces, I think we'd be onto a winner.
Amy, you get the last word.
Yes, and that's awesome because I'm a practitioner. So talking from Ben's point, which is gender responsive and all of that, perfect. And tying very closely with Isadora's point of putting that together. So from where I sit, I would like to see, I don't want to wait till another pandemic, whether it's Ebola, Lassa, malaria, they're all here with us. I want my government, my country, my state to have a gender responsive preparedness plan. And I wanted it yesterday, not when it happened. I want it yesterday. That's one. And of course, we have to do all that gender analysis. So all this wonderful data, I want them to use it. And I want whatever implementing partners, donors, civil society, NGOs like myself, whatever we need to do now to get them to use it, to get them to prepare that plan to begin to happen. I want, and here am I with many, many wants, but I want women's inclusion. It has always been and still is a source of a bone of contention. Add more women, include more women. Women were at the front lines in both rural, in peri-urban, in non-governmental organization, in charity, faith-based, and even in government. Unfortunately, they were not that space at the government level. So I don't want government to think of this as an afterthought. I want it to happen. And so that pathway that Isadora talked about, it needs to happen. So what do we need to do? Do we need to give them more support? Do we need to give them more platforms, more opportunities like this for them to speak? Thirdly, in terms of data, I want to see more data around the impact of COVID-19 on women's mental health, whether it's in the workplace, whether it's the informal market. I think it is missing, especially in Nigeria, where we think of mental health as something else. Nobody wants to think that I'm going mad. They think, oh, but it is affecting women in Northeast, in the humanitarian sector. It's affecting women and men in Northwest, in Kaduna. It's affecting women in Lagos. I want to see that it's increased exponentially in terms of not just the data, qualitative and quantitative, but the results, the resources that go into supporting structures, institutions, and individuals in ensuring some sustainable interventions for this. So COVID-19 is here, is going. There's always another pandemic. Touch wood, there's always another problem. Want action yesterday. Does that help, Charles?
Thank you. Supply, demand, and use, and particularly around mental health. I think that's a powerful way to end. Thank you to all the panelists. I certainly learned a lot. We have been eating into your coffee break. I do apologize. I think Myra is going to probably jump on in a minute or two rather than the 5 we promised. And I apologize, but I certainly didn't want to end that any earlier. We could have gone on much longer. Thank you all.
Thank you.
Thank you.
Hello, everybody, and Charles, thank you for passing it on to me. And we're sorry that we did not take a little break, but the conversation was so interesting. And the conversation already, I mean, since starting with Shelby's presentation and now the conversation that we had moderated by Charles, they all point to what we should be doing now and what are the policy responses and how the policy responses should be gender informed. So in this panel, we're going to explore what some of major organizations have been doing, what kind of policy responses. And I have a wonderful panel, and my panelists are Pablo Lobaton. He is an educational level specialist at the Inter-American Development Bank. Daniela de los Santos, who is a program associate officer in the gender team at UNDP. Babatunde Omilola, who is the manager, Public Health, Security and Nutrition Division at the African Development Bank. And Charlotte Nielsen, who is a senior health specialist at the Global Financing Facility. So we'll start our conversation with Daniela. And Daniela, over the past year, you have been documented the gendered policy responses to COVID-19 through the UNDP UN Women COVID Global Gender Tracker. And it has been, amazing. Is the one, I think, documentation that is telling us sort of what countries and governments are trying to do. So can you speak about some of the policy trends you've seen from the beginning of the pandemic until now? And, what are the areas where most attention has been focused? What we know are important for inclusive recovery, but receiving little policy attention to date? Daniela, it's all yours.
Thank you, Mayra. And it's a pleasure to be here with you discussing these very important issues in this high-level panel. So, yes, as you, well, many of you may know, UNDP and UN Women have developed during the past year this COVID-19 Global Gender Response Tracker. We can copy the link so you can access it on the YouTube chat maybe, but it's really a unique database that monitors policy responses to the pandemic, and it focuses on measures that address basically 3 key challenges. Firstly, the surge in violence against women and girls during the pandemic. Secondly, the unprecedented increase in unpaid care work. And finally, the large-scale loss of jobs, incomes, and livelihoods. So it's a tracker that not only gathers data, but it also analyzes it and categorizes measures depending on whether they are gender sensitive or not. And as of October 2021, the tracker has compiled over 4,968 policy measures across 226 countries and territories. And of those, there's a total of 1,605 measures that were classified as gender sensitive, which means that they either address violence against women and girls, strengthen women's economic security, or alternatively, they support unpaid care work. So basically around a third of the total of measures that we gathered and analyzed are gender sensitive. We also found like around 30 countries that seem to have no gender sensitive response to COVID-19 whatsoever. So what are some of the trends that we have identified from the very beginning? And I'm going to be brief. Basically, the bulk of gender sensitive measures that we found around the world is focused on addressing violence against women and girls. In the last update of the tracker, which dates from less than 2 weeks ago, I think, we have gathered more than 850 measures that focus on violence against women. But there are much fewer measures that aim at strengthening women's economic security, around 500, and even fewer that address unpaid care work, that's a bit over 200. So as you can see, there's quite a difference there. Also, if we look at the regional distributions, we find that measures that address unpaid care work not only have been the least common, but also they are heavily concentrated in the global north, in Europe, Northern America, Australia, New Zealand. On the other hand, measures that address women's economic security, and this is interesting, I think, that do it mostly through cash transfers of different sorts. They are very common in the global south, mainly in Latin America and the Caribbean, but also in Sub-Saharan Africa. So there we have already some trends that I can comment more as we go along the conversation.
That's very interesting. So basically you're telling us that the responses, it's sort of 1/3 are gender sensitive, but that they, in a sense that they have to respond to what we hear are the main ways that women have been affected, except, am I listening correctly that you're saying that gender-based violence has been responded more so than economic security measures and unpaid care?
Yes, exactly. That's the case. I mean, the response for violence against women has been very massive. It has been more immediate, maybe. The response, like I said, for women's economic security, for instance, through cash transfers or other social protection or labor market policies, it was. I mean, it did happen. It was also quite immediate. But there's a lot of focus, a lot of concentration of these policies in the global south, in Latin America mostly, that has a long history with cash transfers that target women. So many of those was sort of adding to pre-existing programs or extending them. When it comes to unpaid care work, that is where we find the weakest link in gender response. Because, well, we have a lot of evidence that unpaid care work did increase and the gaps widened, but all around the world, but we only find a few measures and concentrated in developed countries, basically.
Great. So the Gates Foundation is right in focusing and investing in care, right? I mean, it sounds like there's a big hole there that needs to be filled in terms of policy responses. We'll go to Charlotte. Charlotte is with the Global Financing Facility, and maybe Charlotte also you can explain a bit what the Global Financing Facility is. But we have suggestive evidence that the indirect health impacts of the pandemic have affected women and girls, including in the areas of sexual and reproductive health. What has the Global Financing Facility been doing to ensure continued and expanded, perhaps, access to these services during the ongoing health crisis? Charlotte, it's all yours.
Yes, thank you very much, Maya, and hello, everyone. And just to say rapidly that the Global Financing Facility is a specific financing mechanism that was created in 2015, and we were hosted at the World Bank, and we are currently working in 36 countries with the objective to leverage and seek a better health outcome for women, children, and adolescents. And we're very well aware that the COVID-19 has exposed the persistent health system's weaknesses, and it's reversed the years and decades of gains that the countries made for women, children, and adolescents. And early in the pandemic, in the GFF-supported countries, we saw that the government has shifted resources towards a public health emergency and away from the essential service delivery, including services as SRA, HR, and family planning, maternal and child health care. We also saw that these disruptions led to a decrease that was greater than 25% in the delivery of these essential health services in many countries. The GFF recently shared some new emergent evidence that estimated that the number of women and children dying because of these disruptions of essential health services is twice the officially reported COVID-19 death toll. So that's quite a number. And so some of the immediate steps that GFF and our partners, because we are a global partnership that we've taken together to prevent a secondary global healthcare crisis, is the first step has been around the data and monitoring. We talked about that in the first panel as well, but it's what we did is establish some monitoring of essential health services with our countries. For instance, the analysis of countries' HIMSS, frequent sample surveys that look at the supply side issues and what could be the threats for the essential health services. We also did ongoing household telephone surveys to assess the factors that could influence the care seeking or on the demand side. So with this data and this monitoring, we could then target our specific support. And with that, GFF is what we call an implementing partner of the Act A, and we've launched specific dedicated grants to support the countries so they can roll out additional plans to protect services, the essential health services like SRHR and other health services. And currently we've awarded 12 of these grants, and we hope to be able to award additional over the coming months. And we've obviously continued the specific adaptation and strengthening health system strengthening that is part of our regular work with the countries to make sure that they ramp up the provision of this broad scope of quality and affordable primary healthcare services that is so essential, and make sure that there's a flow of money to the front lines where the biggest needs are. Maybe I can stop here.
Thank you. So just let me ask you, we think that, oh, well, the pandemic has affected everybody, all women, but there's a lot of heterogeneity, right? And it, at the local level, at the region, have you sort of directed, seen that in some countries are doing worse, or some regions, or and has the Global Financing Facility then responded differently to different situations?
I think we are what we call a country-led model. So it's obviously also based on what comes out of the countries. But what we've seen is that some countries have had a tendency of having a stronger or a worse economic impact. And what we've done is ask the countries and the Ministry of Finance to voice if they felt that there was a need for this extra support for these essential health services. We've seen a bit more in the African region, but that's not. We also work in other regions, but that's our main focus. And we did get a lot of. I think we got 31 replies from Ministries of Finance asking for additional support for the maintenance of essential healthcare.
Great! Wow. So talking about Africa, Babatunde, you work at the African Development Bank, and you're clearly an expert in public health. So do you think the pandemic presents an opportunity to rethink health services with a gender perspective and significantly expand and improve sexual and maternal and child care coverage in Africa? What will this take? What is the African Development Bank thinking about it? Babatunde, it's all yours.
Thank you very much, and thanks for the invitation. Let me begin by saying that when the pandemic hit, the African Development Bank responded very swiftly. Our board approved a $10 billion COVID-19 crisis response facility to stabilize African economies, but also to provide social safety nets and also the medical equipment needed across different African countries. In addition to that, we launched a $3 billion social bond to lessen the social and economic impacts of the crisis in Africa. And this has been applauded globally as the largest dollar-denominated social bond on the global market as at that time. In addition to that, we have supported the African Centers for Disease Control and Prevention by providing a grant of almost $28 million to them to build its capacity to respond to the crisis. We've also leveraged over $50 million to support the World Health Organization in Africa to be able to support our regional economic communities in our low-income countries. So we have done all of this knowing that the bank has to support African countries and African citizens. But we have also seen through our support that the gender differentiated impact of this crisis is huge, especially for small and medium enterprises, but also for the informal sector, where a lot of women have been disproportionately affected. So going forward, what we are planning to do as African Development Bank is to support African governments, African countries to ramp up their health infrastructure, because this is badly needed on the continent. And that's why our governors called for the bank to articulate a strategic framework in health infrastructure going forward, which can help us to address different kinds of bottlenecks in the health sector, but also in terms of maternal and child health. And that's what we are focusing on right now. And we believe for the continent, this is where we should go. I'll give you rough statistics very quickly. As we know it today, on average, African governments, they are basically spending around $4.5 billion in health infrastructure. And according to our own analysis at the African Development Bank, $26 billion is needed every year for health infrastructure, whether primary health care facilities or secondary and tertiary health infrastructure, or even diagnostics infrastructure. And so for us at the African Development Bank, this is going to be our focus area going forward. And we will do this by working with different partners, whether UNFPA, UNICEF, to address maternal sexual reproductive health, or with the WHO to deal with health system strengthening on the continent, or other development partners. We're also planning to crowd in the private sector into the space so that we can actually significantly increase our health financing that will flow into the continent. Thank you very much.
That's all very impressive. I mean, clearly it seems that the African Development Bank is ramping up. I mean, clearly responding to what is huge financing needs. Just let me ask you sort of a complementary question. Sort of, what do you think, where are the issues with gender data in terms of sexual and reproductive and maternal health that you think could be improved? I mean, in the past panel, people were talking a lot about, the data needs. Are there sort of big issues that you think that now with the, response to the pandemic, you can strengthen sort of the databases for sexual and reproductive health and maternal health?
Thank you very much. For us, we believe that women are at the center of our economies and societies in Africa. And so access to more opportunity for them is extremely important. So in terms of data strengthening, one of the things that we believe that we should be doing as a bank is to work with other partners to address some of the root causes of fragility, also vulnerability among women, and also many other marginalized groups, especially in displaced places, or in situations of fragility. And for us to do this, We believe that we have to focus on expanding analytics in terms of data monitoring, but also in terms of analysis, and then knowledge work and tools that can help us underpin our strategy for qualitative infrastructure in Africa that we are working on, as well as different policies and operations across the African continent. So let me just give you an example in terms of what we are doing in the Sahel, in areas such as Timbuktu in Mali, or Difa and Agadez in Niger and Kishra in Chad, where we are trying to help them break the long-term cycles of crisis and vulnerability as they affect women in terms of data collection, but data analysis, and also in terms of policy formulation that can help to guide our investments in many of those countries, but also to put more emphasis on early warning of risks, migration, and prevention efforts as they affect women and gays particularly, especially when we talk about sexual and reproductive health. Thank you very much.
Great, thank you. So let's move from Africa to Latin America and the Inter-American Development Bank, the sister or brother to the African Development Bank. And Pablo, Latin America has really experienced the COVID crisis very, very strongly, severely. Actually, Latin America accounts for 8% of the world population, but it has accounted for more than 31% of the world's deaths of COVID. So, you know, it has been hit particularly hard, and schools have been shuttered for most of the last year and a half. This will have long-term consequences for learning outcomes, mental health, as Amy was, and I'm so glad that she was pointing this out, and employment prospects. All areas where girls and women among the poor and excluded populations in Latin America had pre-existing disadvantages. How has the IDB responded to these challenges thus far? And how are you working to ensure that gender gaps don't widen further with the pandemic? Pablo, it's all yours.
Thank you, Myra, and thank you for inviting me to participate today. It's really a pleasure and a privilege to be here. I am already learning a lot, and I'm looking forward to learning even more. Let me highlight two issues. First, you know, we've talked a lot about data, and we are trying to collect a lot of data on key issues. The most important one, obviously, is the impact that the crisis is having. We know that, you know, more than 160 million kids have not been able to go to school for at least 158 days. That's the longest, you know, of any region in the world. And as you precisely said, this is, you know, a huge hit that is going to cause some scars, you know, not only short-term effects on the quality of education, but also long-term effects. And we, you know, we're trying to understand what those are. In terms of learning loss, which is probably the most important one, we know that the initial estimates that are coming from countries are that kids would lose between 60 and 100% of what they would have learned in a year. And, you know, what I want to emphasize there is that we only know this from a couple of countries that are starting to publish this data. So there is a huge need for evaluating and measuring learning loss, learning, you know, during the pandemic, after, and countries are vouching to do more in terms of evaluating. But many of them have skipped their evaluations, their learning evaluations this year, and we're hoping that this won't happen for the next year. In terms of gender, this is, you know, this crisis is going to have a huge impact, particularly because it's one of the areas where we've seen the most progress in the region. We've really seen gender gaps narrow, and in many cases, more women graduating, particularly on the higher levels of education than men. We are also trying to measure the mental health of caregivers, for example, and there is a huge effect there. We estimate, our estimates show that 85% of caregivers are saying that the pandemic affected them negatively, either in terms of insomnia, for example, or fear, all kinds of issues, and that this is very strongly correlated with the support they give to their kids. What we're observing is that 75% of mothers provide support to kids in distance education, whereas only 5% of parents, of fathers, have done so. And that many of these mothers are struggling. 2 out of 3 are struggling to support their kids with distance education. So the situation is quite dire, and it's going to have it's already having huge impacts. We're starting to observe that. We have some data, not necessarily estimates, but we need to do a lot more in terms of gathering data and analyzing, as it was mentioned in the previous panel. And in terms of our agenda for recovery and transformation, we want to ensure that a safe return to school happens, but not necessarily the status quo, right? We think there is a huge opportunity here. We have observed increased flexibility and greater openness to innovation in the education sector, which is traditionally, not very flexible or not very open to innovation. So we see that with optimism. We're estimating that the financing gap is at least $200 billion for the region to not only recover, but to transform their education systems. And this would imply multiplying by 2 the current levels of investment, moving from 4% of GDP to 8% of GDP public investment on education. And we're also very aware that there was already a profound learning crisis in the region, where gender gaps were very significant and a very relevant problem, but also probably one where there are the most opportunities. It's probably a low-hanging fruit in a sense. And the pandemic has come to really, I think, set or make everything, a lot more urgent. There's a sense of urgency, I believe, in the region about solving these structural problems. And it's very important that together we come up with solutions, bringing in the countries, obviously, but also collaborating across different partners. I want to just mention the effects on the labor market, because we're observing that particularly on the proportion of young women that do not attend school regularly, but also are unable to join labor markets. What we're seeing there is that the proportion increased for both young women and young men. But the recovery has been very different. This was already mentioned before in general for the labor market, but it's also happening for young women. They return to the labor market or joining joining back into the education system is much slower for them, and that is a great cause for concern as well.
That is really, a big cause of concern, right? Because the pace of recovery is slower for girls and women. It will really set them back dramatically. The one sort of positive, one of the positive things of the last conversation was Ben Leo saying that people though were aware of all this, and that they were very sort of willing to do actions that are more gender informed. Do you think that is happening in Latin America and more close to home in the IDB? Is there, sort of a bigger sort of acceptance and responsiveness to gender issues?
Oh, absolutely. Now that the IDB has launched a new Vision 2025, for example, where gender inclusion is, at the same level as climate change, for example, right? So we are definitely paying a lot of attention. I believe governments are also paying a lot of attention to gender issues. And there are a lot of initiatives that are either providing more flexibility in the education systems so that young women can join back, or targeted interventions. Somebody was already mentioning today incentives, for example, monetary, but also non-monetary incentives to bring back young mothers, for example, into the education system, that is a huge issue. Another issue we're focusing on is systems to protect the educational trajectories of all kids, and that has huge implications for women, obviously. There we're developing early warning systems, for example, that will allow us to intervene early, because we believe, intervening early it's a huge factor here.
Great, thank you. So, a lot of this is sort of good intentions now. I mean, policies are being sort of redefined. And so I want to go back to Daniela, because, the COVID-19 Global Gender Response Tracker is really sort of what it has been doing, I mean, and very helpfully, but it has been collecting data on good intentions. I mean, what agencies say they will do, but really not actually what they have done. Now, how do we move about from tracking good intentions to tracking actions, Daniela? And what role do you think UNDP and UN Women should play in this? It's a big question, sorry.
Yeah, but it's a key question too. The data that the gender tracker provides allows us, yes, like you said, to measure good intentions. I mean, the extent to which countries recognize and make visible or focus on the gender dimension when adopting policies to mitigate the impacts of COVID-19, but it is limited in terms of measuring impact and the scopes of the measures and the policies. So, however, I do have some good news here. Well, firstly, I should know that since March 2021, the tracker is actively gathering a second database that you can access to that focuses on women's participation and leadership in the pandemic response. And this goes a bit beyond good intentions, because we are actually observing how women have been largely excluded in the decision-making processes during the crisis. We gather information from more than 300 task forces that were created to respond to the pandemic, and 84% of them are actually male-dominated. So we are improving this data set as well, but it provides a bit more information about what countries have been doing in terms of action. But apart from this, as it usually happens, what's going on behind the curtain in terms of data collection is much larger than what eventually makes it to a public dashboard like a tracker. So there are a lot of other variables that we have been tracking as well that are not made public yet. For instance, start and end dates of each policy, status of the measure, for instance, if it's ongoing, ended, if it's only announced, the budget that is assigned to the measure, the budget that is executed up until now, the number of beneficiaries planned and actually executed, but among others. But there are a lot of quality checks that need to be addressed before publishing this information. We need to do a lengthy validation process. That is why it's not made available yet, but we are working on that actively. But I can say that pretty soon the interactive dashboard will include at least timing data for each policy, which will allow to greatly improve the analysis about trends, because we are seeing that there are very different trends when we analyze the different phases of the pandemic in the different regions. There are different kinds of policies that are on the spotlight in those different stages. So that will be an update pretty soon, and we are working on ensuring those quality checks for all of those other hidden variables, so to speak, that will eventually, hopefully, make it into public information as well.
Great, that's great news that you are beginning to track things, and particularly, tracking budgets. I mean, that is very telling. So talking about budgets, and I'll switch to Charlotte, the crisis has hobbled health services and diverted resources away from routine sexual and maternal and childcare services. Will there be additional resources to expand sexual and maternal and childcare services? Where will they come from? And again, another very difficult question. But
Indeed, not an easy question. I mean, no. as I mentioned, we're hosted in the World Bank, and as you know, they do a lot of economic analysis, and we've seen, for instance, that government per capita healthcare spending will remain below the pre-pandemic level. So there is obviously that's obviously something to worry about, and it's so at GFF we have a key priority of trying to mobilize additional resources and pay attention to these health services, and particularly in the region that's been receiving low levels of external financing. And we also work with the countries to make sure that there's a focus on increasing financing to the primary healthcare services and try and reduce the out-of-pocket expenditures to protect the women and girls in these countries of these financial risks that we've been talking about. And speaking of the fact that we're hosted at the World Bank, our financing is linked to the World Bank, IDA and IBRD, and that creates a powerful combination for the countries where we help them to try and build these resilient health systems. And luckily, we've been able to see that the share of IDA financing that goes toward these type of health services has increased by 37% through the GFF engagement, because we push for this type of focus. And as and earlier this year, we launched a resource mobilization campaign that we call Reclaim the Gains, very much trying to put a specific focus on how it is important that we don't forget these essential health services. And where we're hoping to raise $1.2 billion US in new commitments. And in this campaign, we try to support all our partner countries to mitigate the impact of these disruptions and make sure that they can strengthen their health systems. And as I mentioned previously, we've awarded these specific COVID-19 essential health services grants, and we're hoping to get more of those as well. And then obviously we continue to strengthen this country leadership because they need to put the attention, and we need to get their voices out there and make sure that the funding and this maintenance of essential health services is on top of the political agenda. Yeah, so let me stop here.
That sounds, I mean, particularly, sort of getting it into the political agenda sounds at the country level sounds very important. I mean, IDA seems to be just the perfect mechanism to do that. I'm going to ask you sort of a different question that I think is kind of difficult also, it's even more difficult, but sort of the pandemic has revealed how much the health system really relies on the unpaid and low paid work of women in care. And how can we ensure that these volunteers and workers are properly protected and compensated?
That's a very good question as well, and I think one that's become very visible in the midst of the COVID-19. I think we all know that women represent almost 70% of the world's healthcare workforce, but they also sit only on 25% of the global health leadership positions. So first of all, I think there's an issue of the gender equality at the leadership level, and how the lack of gender equality that means that we don't have a very gender responsive health sector. And I think that if we had more women in the leadership positions, we would probably be a bit better at setting the specific spending priorities and policy reforms that could improve the priorities for women, children, and adolescents. And we shouldn't forget that women are both the users and providers. So it's really important that their voices also have a prominent role to play in this. One of the things we do at GFF, we try to support the countries to identify specific opportunities for legal reforms, and that's also legal reforms in human resources for health. So that comes on top of, as we were saying, the political agenda as well. I think it's important that we make sure that women are engaged in shaping these specific dialogues and investments at country level. And also recently, I think many of the people in this conference are probably aware, but together with other partners, we also committed to what's called the Gender Equal Healthcare Workforce Initiative. It's led by Women in Global Health and WHO. And it's an important initiative that's trying to put a spotlight on some of these issues. So GFM, we're very much committed to try and support female leaders as change agents for some of these issues, and also make sure that we work with the local women organizations, so we make sure that the voices are heard, and as I say, on the reforms agenda, to make sure that we get these human resources for health as well. And with the COVID-19, I think we have a strong opportunity to make sure that health systems are redesigned. So we make sure that the comprehensive services, the health services, are moved closer to the users, and we look at how community health worker reforms and that can also be integrated. So bottom line, I think that the pandemic is forcing us to rethink how we do roll out primary healthcare, and that also includes obviously gender responsive healthcare reforms.
Great, and sort of the importance, I think, that you are now saying that it was also, very high in the last session of sort of women as main actors at all different levels, sort of that women's voices need to be heard. Anyway, but sort of talking about, women's voices, but we're also talking about money and cash. And Babatunde, I want to go back and sort of to sort of the cash part of a cash care and data agenda, and tell us how the African Development Bank has supported governments in providing cash transfers and other forms of social protection to those increased risk of poverty and food insecurity during the crisis. And what has it been done to make sure that all these cash transfers benefit women and girls?
Thank you very much for that question. As I said at the beginning, the board of the bank approved a $10 billion COVID-19 crisis response facility in April of 2020. And of course, the responsibilities in terms of how the resources would be utilized by government that received support from the bank are broken into three different kinds of categories. One, to stabilize African economies. Two, to provide social safety nets. Three, to protect jobs, and also to protect the vulnerable and the poor, including, of course, women. And through that, we have been able to provide support in terms of cash transfer to different categories of people, small and medium enterprises, those in the informal sector, and those that have been disproportionately affected by the crisis, especially women. Now, in terms of data, the bank developed what you call new African country gender profiles in 2021, which revealed that African women are still disproportionately affected by poverty, and the pandemic is exacerbating gender inequalities. Basically, through these profiles, the bank is calling for gender issues to be prioritized in all the COVID-19 recovery processes in different African countries. In terms of advocacy, the bank has a Pan-African initiative that aims to unlock financing to bridge the $42 billion financing gap facing women in Africa. We call this Affirmative Finance Action for Women in Africa initiative, AFAWA, to really help cushion the impact of COVID-19, and as well as to provide governments with the resources that they need, that they can deploy in terms of stimulus packages, fiscal and monetary policies that can target women-owned businesses in different African countries. So these are some areas where the bank has been playing a very catalytic role to make sure that the impact of this crisis is really mitigated, especially when it comes to women, girls, the marginalized, the vulnerable, and the poor people in our different African countries. Thank you.
Great, thank you. And that sort of brings, to my mind again, the importance of having good data, because we will want to track and see how those monies will be spent. And if we don't have the right gender data, that will not enable us to track and measure the effects of the program and accountability. And I will, actually, we're almost to the time, but I will close it asking Pablo the one question when, the pandemic really sort of hit Latin America very, very hard and deepened inequalities that already existed there. And particularly, inequalities that intersect with each other by gender, race, and ethnicity. So what is the IDB doing or will do about this? And there's an issue with data also. Are we measuring? Do we have the right measures to capture this intersectionality? And I think with that, we will finish. Pablo, it's all yours for 2 minutes, maybe, or 3 at most.
Thank you, Myra, and I'll try to be brief. But I want to highlight that these are extremely difficult and challenging circumstances, right? Where that governments are facing with very limited capacity and very limited resources, right? So in that sense, I think they're doing a relatively good job, and so are everybody that is involved, right? From the bank. On this is, the financial instruments have to do a lot also with the data needs. So we're emphasizing a lot, for example, results-based financing that will focus on monitoring, on evaluating, and rewarding countries when they achieve certain results. And we think that is very promising. But also using blended finance, right? So we need to pull resources together because resources are so limited. It's not a question only of spending more, right? But of spending better. And in terms of reaching these marginalized populations, that's particularly important, right? Because better data allows you to better target those policies. And without it, without that data, without the financial instruments that allow you to collect that data and make use of it, I think it would be very hard to provide accurate resources, and accurate policies precisely in such challenging and difficult circumstances where resources are going to be very limited.
So thank you so much. So we have to be very smart in the way that we use resources and we gather data and we use data to better the situation of everybody, I think, as coming out of this crisis. So with that, thank you so much to the panelists for your wonderful participation. And I turn over to my colleague, Megan O'Donnell, who will moderate the last session.
Thank you.
Thank you very much.
Thank you very much.
Thanks so much, Myra, and thanks to all of you. We are now rounding the corner into our third and final panel of the day. So without further ado, I'm going to introduce our 4 fantastic panelists who will close out today's conference. First on my screen is Andrew Hurst, who is the Director of Economic Growth and IFIs at Global Affairs Canada. Then we've got Rupa Hinton, who is Social Development Advisor at FCDO, Laura Alfers, who is Director of the Social Protection Program at WeGo, and last but not least, Nithya Nangalia, who is Coordinator for Social Enterprises and a central team member at Sewa Bharat. Welcome and thanks to all of you for being with us today. Laura and Nithya, I'd love to start with a question for both of you. The speakers in our previous 2 panels have done a lot to shed light on the gendered impacts of the crisis, whether we're thinking about disproportionate income loss or mental health effects or increased unpaid care work that women have disproportionately shouldered. So I would love your reflections on what you've heard already today and how that aligns or maybe contradicts what you've seen, Nithya, in Sewa's membership, what you all have observed, and Laura, as you look more globally at women working informally. Nithya, why don't we start with you and then over to Laura?
Thanks, Megan, and very happy to be here with all of you. I think I very deeply resonate with all that was shared with the panelists before this. And in fact, I'll share some nuances from our experiences here at SEWA. I work with the Self-Employed Women's Association, which is a union of 2 million women in India. And when the pandemic started last year in the first wave, our focus largely was on the access to nutritious food and cloth masks as a part of relief efforts. But also was about raising awareness about COVID and addressing the myths which were very rife at that time. And a very big thrust of focus was on social protection. And I think I'll keep bringing that back in as we talk, which was one of SEWA's cooperatives launched a product for COVID insurance. A lot of women went out and enabled access to pensions and subsidies, which were the basic means of support for many people in rural India. Many people went door to door, especially in hilly regions, to enable access to such financial assistance too. In the first wave, while the health impact was a little lower, livelihoods were completely paralyzed by a shutdown of the traditional markets. And this is where SEWA played a big role in enabling access to either pivoting livelihoods. It may be through other livelihoods like stitching masks or working with the government through safely reopened street markets and helping collectives in pivoting their businesses. One of our very big learnings at such a time, and validated by global experience, was that women who were connected with collective enterprises at such a time were able to get work faster and recover their livelihood faster at such a time. 71% of women who got in touch with SEWA's cooperatives were able to get work or some business opportunities, and the savings of collectives were deployed towards securing jobs rather than turning towards layoffs at such a moment. I think I'll also talk about just the sheer scope of innovation and the ability to learn, which is existent at such a time. So while traditional markets shut down, we focused towards digital literacy efforts and enabled women with smartphones. And at such a time, we started exploring these efforts really matured quickly into selling online or to pivoting livelihoods by, say, collecting data on the impact of COVID on poor women. And that's something that we trained women to become data collectors. It's become a source of non-traditional livelihood. And in fact, many of these younger girls were the only income earners in their houses at such a time because of such a livelihood source. The second wave in India was much more devastating in its health impact. And at this time, SEWA members were at the forefront because of emergency health efforts. A lot of health awareness, especially for poorer women who do not have the luxury of space for self-isolating. And how is it that you deal with the symptoms at home at such a point? I would like to close off with just reflecting on all of this work was possible because of the deep-rooted presence of SEWA's community leaders over decades at such a time. These were the last mile responders who, because they knew which were the people most in need next to them, either for food, either for health awareness, or either for emergency health assistance. And this enabled us to make sure that relief efforts extended to 3.3 million people over the last year. I look to Laura for.
Thanks, Nidya. I think it was a very good point about the strength of the community organizations and how important they were. It certainly came up in our survey of informal workers' experiences through COVID, was the importance of these grassroots organizations. I mean, I think thinking a bit more globally, and perhaps linking back to a bit more about we've heard, we hear a sort of story of, we're going into recovery, we're in an economic recovery. And I think many women informal workers in particular are very far away from being recovered in any sense. And I think we've heard that from a few people. And as Lydia said, social protection. I mean, what we saw were relief responses for sure, that reached some workers, and which there is certainly something to be learned from, but so many people are still without the kind of social protection that people need throughout the life course, that women need throughout the life course. So I think this idea of longer term social protection coverage is still a big issue in terms of what are the ongoing needs of women working in the informal economy. It's great that COVID has opened up space. I mean, I'm sitting in South Africa where we now have an active debate about the implementation of a basic income. And certainly before COVID, that was a very difficult discussion to have. We now have that policy space. So maybe going forward, we will see those changes. But I think we also heard about how incomes just aren't recovering. And, we've done a longitudinal study of informal workers in 12 cities. And our latest data is just coming out now, and incomes still aren't back at pre-COVID levels. So these impacts are long-term, much greater debt, asset depletion. I think we heard all of that. So, I mean, there really is a need and an opportunity to think about, sector-specific economic recovery plans. Domestic workers are going to need different kinds of interventions to self-employed street traders who are going to need different interventions from home workers working in global supply chains. And I think that there's a necessity to think in a sort of more detailed level about which groups of the informal economy, where there are many women working, have been hit hardest, and how are we going to work to support them. And then I think a final point, which I didn't hear a lot of, we've heard a lot about violence, gender-based violence. But one thing that we know that many informal workers are facing is violence in the workplace. So while we may have had governments scrambling to put in place relief measures, local governments in particular have often used the COVID crisis as an excuse to ramp up the kind of harassment and punitive behavior against informal workers. And many, many women are caught up in that, as well as men, and women can suffer more. And I think it's something that perhaps within the discussions about the violence and COVID perhaps needs to be emphasized. And, we're still seeing it. We're still seeing, even though the punitive lockdown regulations are loosened, there's a hangover to that. And it has huge economic impacts, as well as impacts on all sorts of indicators of well-being. Thanks.
Thank you both. Nithya, thanks for already diving in to highlight, how SEWA as an organization has mobilized to support these women during crisis through support for collective enterprises, digital literacy programs. You've shed light on a new dimension to this gender data conversation that's been sort of cross-cutting across panels, the fact that this is an income generation opportunity for women themselves. And then Laura, thanks for highlighting what is still needed in longer term. Dare to not use the word recovery now, right? That we still very much are in the early days of what's going to be a much longer term agenda needed. Rupa, would love to turn to you to pick up where Laura just left off. Can you speak a bit to what FCDO has done already in terms of sort of responding to the gendered impacts of the crisis, maybe especially with that social protection angle top of mind?
Yeah, I was going to say my starting point will always be social protection, just because of where I sit in FCDO. But obviously, FCDO as a whole has taken a much broader response to kind of COVID response and recovery, and gender's been a strong part of that. But before diving into the social protection COVID response, it's kind of important to point out that we've been pushing for a greater gender focus in social protection for quite some time. We launched the Gender Responsive Social Protection Programme back in 2018, which works with FCDO, so our own programs, our own teams, with the World Bank and with UNICEF to build evidence on what works and to shift our operations and our policies. And I think COVID-19 neatly demonstrated why that's been such an important thing for us to be doing and for us to be pushing on this front. Social protection gained lots of prominence in the response to COVID. We've seen unprecedented scale up in these measures, across many countries. But most of these, the vast majority, haven't been gender sensitive. And we heard about this earlier in some of the earlier panels as well. And I think what this really shows, and it's something Laura said too, is just the big gaps pre-crisis in terms of the gender responsiveness of social protection systems. They're not geared up to respond to these various various vulnerabilities and needs that women and girls have, gendered inequalities. So for us bilaterally, we would have, most of our work would have happened at country level, essentially. New programming, adapting existing programming, trying to make it kind of more appropriate to the crisis at hand in various contexts. And we did see a big increase, I guess, in our support for social protection over the last over 2020. Centrally, we tried to support this by establishing the SPACE TA facilities. So this is the Social Protection Approaches to COVID-19 Technical Advisory Facility, and it provided advice to our own teams, to governments, to international organizations on how to adapt these existing social protection measures, or how to put in place new measures if they didn't have these systems in place already. And I think the thing to point out here, the kind of innovative approach that we took with this was just making sure that gender equality and social inclusion was part of every assignment. And I think that started as a kind of conversation starter with a lot of places, a lot of partners, but actually it turned it into the DNA of our crisis response, or our COVID response space. We also ensured that gender and social inclusion were part of all our operational guidance and policy research that was coming out of the SPACE TA facility. And kind of looking to Laura on my screen now, but I'd like, point you to the paper that she authored on an inclusive economic recovery. And I think the important thing there was saying, what do we need to do to make sure that our recovery from COVID is gender responsive, is inclusive? Lots of opportunities actually to do that. And then finally, as chair of the SPIAC-B, so the Social Protection Interagency Cooperation Board, which is a group of donors, international organizations working on social protection, coordinating better around it, we have a gender working group. We worked with partners to develop a call to action on COVID-19, social protection responses, and gender equality. And I think this came out largely because so many of these measures were just gender blind, or had really not considered gender at all. And we felt it was important to set out what a good response and recovery approach would look like from a gender perspective. So I'll stop there. I've talked too long probably.
Thanks so much, Rupa, for highlighting all of those efforts, and soon want to talk to you all about how we build on that good momentum for longer term social protection effort. But first, Andrew, I want to bring you into the conversation. Same question, can you speak to Global Affairs Canada's approach from a gender perspective to COVID response, relief, recovery, and what you all have prioritized?
Sure, thanks, Megan, and good morning, good afternoon, and good evening to everyone. Thanks very much for inviting me to participate. Just in some respects, like the UK, Canada has taken a gender equality and human rights approach to its international assistance since 2017. We have a feminist international assistance policy that has 6 action areas, of which gender equality is core and cuts across everything that we do. So in a sense, when the pandemic hit, it both proved the validity of that policy framework, but also was the basis for us to double down on our efforts to address these issues and support partners around the world to advance on the range of agendas where that we were engaged in. So in the current context of the pandemic itself, this is applied across all of our engagements with all of our partners at multiple scales. Obviously, at the multilateral development banks that have been at the forefront of the response. Canada has been a strong voice in making sure that gender equality is something that's factored into those efforts. Now, the record has been a little bit mixed. There's been some good progress made at those institutions in incorporating gender considerations into their programming, their strategies, their data gathering and data management, but more could certainly be done. We've also, as many participants are likely aware, Canada has initiated a number of platforms over the past few years that have tried to find new ways to support and build the capacity of a variety of women's rights organizations and civil society organizations whether it's through the Women's Voice and Leadership Program or the or the Equality Fund rather. And we found in the context of the pandemic, of course, a lot of these women's rights organizations really struggled. And so we've been working through those platforms to see how they can't continue their operations and stay engaged. I was reflecting on the earlier conversations and how, some of the challenge relates to data and evidence for decision makers and policymakers at the government level and the technical assistance that can be provided. But of course, there's always a political dimension to this. And unless there's a strong movements and organizations in countries calling for governments and other actors to respect and promote the rights of women and girls, it's not going to happen as fast or as effectively as it could. And so that's been a critical part as well of Canada's effort. I think in terms of the focus, we're, from our own efforts, we're still very much emphasizing the health dimensions of the response, because we see in many parts of the world, even vaccination rates are still very low. So I don't think we can, as much as we're trying to work with our partners to prepare for recoveries, we're still very much focused on the response and stabilization efforts to date. So maybe I'll just stop there.
That's great. Thank you, Andrew. And your comments sort of bring us to another part of the conversation that I'm keen for this group of 4 to have together, which is strengthening the connections between those with financial resources to offer and those grassroots women's organizations who are on the front lines of doing a lot of this advocacy and implementation work. So you've highlighted the Equality Fund that Canada has launched. The Netherlands has the Leading from the South Fund. There have been a number of philanthropic foundations that have taken similar approaches. But back, Nithya, to you on this one. How do we strengthen kind of the funding, the financing support for organizations like SEWA and others, and strengthen those connections between the grassroots and those with sort of the power of the purse, so to speak?
This is a dream question. And I will start off with, I think, what Laura left us at, which is that incomes are just not recovering. And I think our experience through multiple crises, whether it was the global financial crisis or the pandemic now, is that it takes up to 3 to 5 years for women who lose the base of their savings and their daily wages to recover back and build back from this. And the first thing we recommend, and we've seen a lot of support of, is just restoration funds. To start off with that, we have seen some smaller funds like Artisan Livelihood Assistance Fund come in at such a time, which just helps people with that basic capital required to get access to raw material or whatever it is that they need to kickstart their livelihood again. And that is when comes in the role of any other credit facility. In many cases extended directly to the workers, but we also think again to go to the worker-owned cooperatives or any enterprise support networks which are linked directly to these worker-owned cooperatives, which can enable circulation of livelihood assistance funds, working capital, all of it at lower interest rates, but building corpuses of it. We got it from UK Cooperatives Movement, was particularly helpful. It gave us access to what may seem very small, but was just INR 1 crore, but it was extremely helpful to the smaller scale cooperatives in restarting their work at such a time. I think the third thing, which is again, is social protection, which is how is it that you can make sure that everybody in the cooperatives again has COVID insurance, health insurance, which protects them at such a time. I would just pause here.
No, that's great, and is a perfect segue to turn to Laura, back to these points that many of you have just made on needing to transition from social protection and relief as these sort of one-off temporary measures into a longer-term agenda of making this the norm. So, Laura, what are the policy and sort of investment opportunities before us? I mean, we think about special drawing rights conversations happening at the IMF right now. Is there opportunity to ensure that some of those funds, once they are hopefully reallocated, have social protection prioritized? Is there scope for a global social protection fund? What should we be thinking about in terms of solutions?
I think we should be thinking of all of the above, quite frankly. I think it's a huge ask, and I think as many sort of solutions as we can gather. It's so whether it's the special drawing rights and the Global Social Protection Fund, the idea of the Global Social Protection Fund, I think, is a really exciting one. But its aim is to reach about 10 low-income countries with additional financing for social protection. So I don't think we can see it as the answer to social protection financing. It's going to have to come from multiple sources, and sort of international sources of financing are going to be really important. I think the Global Social Protection Fund is the one I've engaged with most. And I think it does have an interesting idea behind it, because it has at its core the idea of solidarity. That countries in the global north will help to finance, social protection in the poorest countries in the global south. It also has a strong element of, global corporations need to contribute to the welfare of the people from whose work they often are profiting, but may not necessarily be taking responsibility for through an employment relationship. And I think that's also a strong aspect of the Global Social Protection Fund, which is interesting, that it's that conversation about what are the responsibilities of the private sector to workers who may not be in an employment relationship, but are certainly part of the economic value chains which make up the global economy. So yeah, I think it's interesting. I know that there are many discussions about where the fund can be located, whether it's a good idea to locate it, for example, within the UN system or outside of it. There's huge questions to be asked about governance as well, and to what extent we would actually see, the people for whom this is meant to impact being involved in the governance of the Social Protection Fund. But certainly, I think it's an interesting idea. It's not a new idea. It's actually an old idea that's been revived. But I think it keeps being revived for a reason. Yeah, I'll leave it there. Thanks.
And with COVID having exacerbated the reasons for the need for something like this, Rupa, want to bring you in as well. Reactions to the idea of a global fund and other sort of pathways for the policy and investment agenda in social protection. I know you and I have worked quite closely on the IDA replenishment agenda this past year. What opportunities do you see for transitioning this sort of short-term discussion into a longer-term one?
Yeah, no, not an easy question, not an easy challenge at all. Without getting drawn in specifically on the Global Fund, I guess I would say we need a blend of financing options. We're not going to be able to finance the social protection gaps that we currently have through one mechanism or one route only. We've been kind of working for a long time. We've been saying there's a need for ODA, of course, but there's also a need for nationally owned systems that are sustainably financed, and there's a big role for the kind of multilateral development banks in that space as well. Linked to that though, there's a whole big wider debate that I think we could get into around kind of progressive taxation schemes and making sure you're not giving with one hand and taking with the other, and gender is such an important part of that, yet gets so little airtime in that kind of that debate. So I think the whole kind of tax and transfer balance and what that means and the gender implications of that's really, really important. But I kind of think COVID then wiped a lot of that out, and this is just speaking very personally, but we've seen both the massive gaps in social protection, huge needs that have been created, all at the same time as we know the economic recovery is slow and we aren't going to get there. We're not going to get back to where we were pre-COVID. We've heard that panelists have talked about this already. Therefore, you have these massive financing challenges. And it's really interesting. I was reflecting on this. I've been immersed in COP26 for the last 2 months. I don't think I've thought about very much else apart from gender, social protection, and climate change. And I do think there's some potential for us. Looking at some of the ways in which, the pre-financing mechanisms and how you link those risk financing models to social protection delivery mechanisms, I think it can offer us an opportunity to make sure finance is available through varied sources, such as the climate funds, for example, or other kind of disaster funds, to ensure that we can respond quickly to these sorts of crises. And that we are looking across a range of financing sources to support social protection in its response to things like COVID, or in response to climate crises and things like that. Not the entirety of the solution, because obviously what we saw with COVID, and I think Laura said this too, is where you don't have strong investments pre-crisis hitting, there's lots of limitations to social protection systems as part of a crisis response as well. But that's sort of a rambling, not very specific response to your question. But I do think we need to look across a range of sources of financing. The one thing I would just say before I'll stop talking is, I think sometimes with insurance, and we've talked, the SEWA example is wonderful. I think it's a really big challenge when it's placed on individuals, particularly the poorest, most vulnerable individuals, be able to fund their own insurance schemes. And I think that's where we need some real kind of government and international organizations, donors, to step in and say, you need to support women's access to social insurance schemes, otherwise they won't access them and they will be more vulnerable when crises hit. Stop there.
Thank you. And I appreciate you bringing the climate sort of angle into the conversation, because I think you're right. We need to be thinking about these linkages between different sources of finance that unfortunately tend to be siloed from one another, and integrating gender into climate conversations can not only maximize the impact of those funds on the most vulnerable, but it also opens up, new opportunities for financing for the populations we're discussing. Andrew, any additional thoughts on the social protection agenda, the longer term? Sorry about the echo. And then also would love to broaden a bit, because as we opened today's conference, there's been, as you all have heard, a focus on cash, but also care and data. And have been very impressed with the Canadians sort of stepping out unilaterally at this time as a DAC donor, making a commitment at the Generation Equality Forum around strengthening the global care economy. So would love for you to be able to comment on that as well. Over to you.
Sure, thanks. Maybe just briefly on the question of financing and institutions, and whether I won't speak to the wisdom of a global social protection fund per se. Just that I think one of the things we do need to do is make sure the existing institutional architecture works better to address these issues. And we are seeing some signs of progress, albeit they're never fast enough. I was pleased to see, for example, that the IMF now has a gender advisor, because of course debt has huge implications for governments' abilities to offer social protection, maintain liquidity, and do all the things that we want to see happen around inclusive growth. Similarly, on the climate agenda, I mean, I agree wholeheartedly with Rupa's point. There's going to be a lot of emphasis on climate resilient infrastructure. Well, we should also look at that from a gender perspective, and we've been quite active in the G20, which has done a lot of work on quality infrastructure investment principles, and we've made sure that that's been included, the consideration of the impact on gender and women. So I think there's lots of opportunities for hooking up gender equality and ensuring it continues to get integrated into other related agendas, because we know that has profound impacts on gender equality itself. Specifically on the care commitment, yes, we were very happy to see our Prime Minister announce this commitment back in July. We're still working out exactly how we're going to implement that. In fact, I have a briefing with our new minister tomorrow, but I can. It's safe to say that it will likely deliver that through multiple partners. I mean, there's some really interesting ideas at the multilateral level, but again, CSOs and women's rights organizations will feature very, very likely as a part of that approach for us. Now, in some respects, saying that care, we're having a standalone commitment to that could be argued to contradict what I've just said about hooking it up to other agendas. But we do see value in calling this out as an important issue, right? It's not new. Feminist economists have been talking about the care economy for decades. But in the context for us with our feminist international assistance policy and its focus on women's economic empowerment, we do see care as a fundamental obstacle to women's equal participation in economies. And unless women are participating equally, you're not going to get growth and growth processes that are either inclusive or arguably sustainable. So while we very much see care as an issue that's embedded in a number of other challenges associated with gender equality, and it's a human rights issue as well, I should say, it's not just an economic issue. We feel that the time is right for all sorts of reasons to raise the attention on this, and hopefully in a small way with this commitment, help make some progress in working with governments and local actors to tackle these issues.
Thanks, Andrew. And back to get the local actor perspective, Nithya, SEWA's been working on childcare support to its members for many years. Can you speak a bit to those efforts and your perspective on how we build on Canada's commitment now to this agenda and get other donors and other governments, importantly, to be supporting this as essential infrastructure?
I think about 30 years ago, SEWA started this, which is how it started its work on reflecting on why is it that women were not able to step out and work. And in many cases, when we were providing finance to women, were they able to pay back? And many of them would become young mothers, fall out of the labor force, not be able to come back, and simply because they did not have access to childcare. And providing childcare services nearer to their house meant that they were able to go in peace for work, earn a full day of wage, make sure that the children had access to nutritious food, quality preschool education, and which resulted into 100% enrollment into pre-primary education afterwards also. All of this loops into how is it that childcare models have still not been able to trickle down to the bottom of the pyramid, unfortunately. Government services just do not exist. And while they do exist, in India, there was a large-scale Anganwadi scheme which was launched. It is only available for half of the time that people need. So I think the conversation loops back not just into finance. I think there is a lot of recognition on the need for childcare, but in program design also, what kind of childcare efforts are required for women who are most marginalized to allow them to step back into the labor force at such point.
That's great. And my colleague, Myra Buvanich, who you saw earlier, and I, for years, really with her as leader at the helm, have done a lot of work on what works to promote women's economic empowerment over the years. And time again, if you're thinking about job skills training programs or anything that will require women to take time out of their daily schedules, neglecting the time and mobility constraints that they face because of childcare and broader domestic and household responsibilities results in them not participating, right? Higher attrition rates, women not being able to benefit from job skills training, social protection, workfare programs, and the like. So a critical point. Laura, I know that WIDO has done lots of work on this childcare agenda as well. Your colleague Rachel and others have really led the charge for supporting these systems for women working informally. I don't know if you want to come in on this.
Yeah, well, inspired by SEWA, in fact. So SEWA was the inspiration behind WIDO's work on childcare. And we were strongly pushed by them to make it a part of our social protection work. I think just to say that, and perhaps it's not needing to be said again, but I think childcare as part of an economic recovery plan is quite fundamental, and ensuring, I mean, I think COVID made it clear how important it is to the economy, you know, for everybody, although women were hit hardest. I think, you know, a lot of people realize this. But there is a kind of feeling like women working in the informal economy, they're self-employed, they have some flexibility, maybe they don't need childcare as much. And I think, you know, that's a fundamental mistake to make. And that if we, yeah, as you say, anything that is about economic empowerment, if the childcare sort of solution isn't there, it's not going to work like it should. So, I mean, we've been very involved in 3 African countries in trying to make sure that, you know, at local level, at the level of the city, that childcare is integrated into any kind of recovery plans, to make sure that, you know, when they're replanning markets or when local government is replanning an informal workplace, that there's some kind of childcare facility in there, and that's seen as a sort of integral part of making that microeconomy function. So yeah, just to add that.
That's excellent. Yeah, and I'm sure findings that would be helpful as donors going forward seek to sort of expand their investments in this area. Rupa, has the care agenda been something top of mind so far in FCDO's work? Is this something that you could see featuring increasingly going forward because of the pandemic?
Yeah, no, I do. I think that, as Laura said, I think that everybody experienced it firsthand in lots of ways, in a way that they probably didn't necessarily experience it firsthand before that. So I think it has brought it to the forefront of people's thinking. I mean, in terms of social protection, I think we could do a lot more as FCDO and with our partners to kind of design, deliver care-sensitive social protection systems, both in terms of, you know, just thinking through public works programs that we support. You know, do they have adequate being the wrong word, do they have really good childcare facilities? And I think in general, the answer to that is very often no. And I think there's a barrier then to women, or there's the knock-on impact for other generations, whether it's adolescent girls or it's older women, to kind of pick up on those kind of care responsibilities as well. I was also going to kind of go back. I didn't intentionally dodge your question on IDA 20, but I realized I did. And I think this is a nice kind of segue back into it, because actually part of the financing solution to some of these questions will be about leveraging large funds that already exist and large investments that are already made. And you know, there's a huge amount of money going into social protection systems globally from various actors, including the bank. And I think there's a lot of opportunity to kind of leverage those investments. Even with small changes, small design delivery tweaks, you can make these more gender responsive. And I'm thinking about the whole focus in IDA 20 on care, which we have to kind of recognize, and I think applaud the bank for actually doing. I wasn't anticipating that coming out as a really strong theme, but there it was, and I think it's super important that it did. And I think the opportunity there is to see social protection systems as one way in which we can achieve those objectives around care, and strengthening those social protection systems so that they do deliver for women in a kind of diverse set of ways, not just, you know, looking at the kind of care needs that women have as well. But yeah, so I think focusing on how we can work with key partners like that will be a priority for us going forward. We've been quite keen to bring together our work on women's economic empowerment with our work on gender responsive social protection, you know, just to make sure, you know, you can't really do one without the other, essentially. And I think there's a nice opportunity now for us taking this forward.
I'm really glad you looped back to IDA, because I do think it's super relevant to this part of our conversation too. You know, for those of you listening who are not quite as in the weeds of some of these special theme papers and results frameworks, you know, I too was very excited. It is unprecedented that an IDA sort of results framework has included a target around childcare ever before, and that's credit to Amanda Devercelli, the ECD lead at the World Bank, and others who've been working to sort of increase the prominence of childcare as an investment priority. But of course, more work to do to build on this early momentum. So Andrew, maybe back to you to pose the same question I posed to Nithya at the start. How do we catalyze some of these early promising targets and conversations and make sure that other donors and also governments in their domestic budgets are seeing this as a critical priority, the way that they would see, health or quality education or other areas of investment?
Yeah, thanks. I mean, I think it's a combination of push and pull, right? Because in the case of thinking about IDA, for example, I mean, IDA they have a whole the new IDA 20 policy framework has got a whole load of objectives and commitments, and as a client who would be looking to access IDA resources, it's probably a bit mind-boggling and somewhat challenging to see how best to access those resources in ways that meet some of those requirements. But there'd be four things that I would say would really be important to kind of continue the momentum on the care issue in particular. First of all, that is to continue to show the benefits to governments of addressing this issue. I mean, we have evidence on the, in pure economic dollars and cents terms of what kind of benefits can be generated by addressing and providing quality and accessible childcare on economic growth, whether it's through wages or other transmission mechanisms. The second thing, and this is a bit more of a stick than a carrot, and that's to remind governments that they're duty bearers, and that this is a rights issue, and that women and children are that this affects their rights if these issues are not being dealt with effectively and efficiently. The third thing, and this relates a little bit to the question of evidence, and it's not so much evidence of what the impacts are, but evidence of what we know works and why, right? So, we do have some evidence of certain things, but there's also lots of areas where we still don't know. And I think because of the changes that the pandemic will have wrought, there will be a continued need to have a kind of learning dimension to our efforts around this. And we continue to stay engaged for our part at a variety of levels with actors that are involved in supporting that kind of applied research. Our own IDRC has long done work on this issue and are a really valuable partner for us in that respect. And then finally, this just brings me back to my original point around supporting the local actors who have long been engaged on these issues, and to make sure that they are able to continue to take forward with their advocacy efforts, that their organizations, the networks, the movements, and the alliances that they're a part of have the capacity to do so, and that they're provided with the kinds of financing that allows them to stay engaged in a continuous way, and it's not kind of projectized aid. So those would be the four things that I would say would be the most effective way of continuing to the momentum on this agenda.
That's excellent. Thank you, Andrew. Music to our ears that we need to continue to build the evidence base to guide decision making, but also be listening to those who already have a good idea on the ground of what is needed. And on that note, we've got just a couple of minutes left. So want to give you each just 1 minute of maybe closing thoughts. We've had very rich conversations throughout the day or afternoon or evening, depending on where you are, on the disastrous consequences of this crisis, on what donors and policymakers have been doing in response already, and would just love to conclude with the third and arguably most important question top of mind, which is what else is needed? So Nithya, maybe starting with you, a call to action as we conclude.
I think the simplest and most obvious but never thought of action is the people who need it most should be the people voicing it where the decisions are being made. And how is it that we make sure that they have a seat at the table over there? And that's my call to action, that today's conversation has already run over all the themes of work that need to be done. But is it really inclusive of the voice of the people for whom the work is being done? So I would just stop at that.
Thank you. Laura.
Yeah, I'm not going to diverge too much from the theme Nydia has put forward. I think, you know, we think a lot about policymakers and donors and all the big actors, and often we don't think enough about the communities and the grassroots organizations and the organizations that actually make things work. So I think we saw in the COVID responses, the relief responses at least, you know, yes, having the state, a stronger state social protection system before the crisis was really important. But where we saw the best sort of reach to informal workers of the relief efforts was where there was already a sort of relationship between the grassroots organizations and community organizations and the state. And that relationship is not something that just gets built up overnight. It's something that is fostered over years and years and years. And it does show you, I mean, the relief response where it was most effective, there was, you know, it wasn't just the state, it was communities coming together and assisting and being involved and being part of that. And I think as we go forward, more recognition to the work that communities do in all areas of policy that relate to economic empowerment and social protection. As equal partners in the discussions, and having voices heard and represented is important. Thanks.
A very clear message from you both. Thank you. Over to you, Rupa.
I was actually going to stay with the same theme. I think, like, building on what Nikia said, it requires, from my perspective, as sitting in a donor organization, it requires a change in a fundamental shift, I think, in how we approach our social protection work and the relationships and the support that we provide. So we've taken a really strong kind of rights-based approach to social protection, governments having responsibility for delivering them, supporting governments, strengthening systems. And I think, you know, that's really important. And I'm not going to say that's not important, but perhaps it's swung too far that direction. And we have neglected, I think, the role that local actors, grassroots organizations are playing, can play and should play in social protection in stable contexts, let alone, you know, we saw that with COVID, the big role, the importance of the role of local actors. But we don't necessarily support it kind of in our social protection programs in non-crisis moments. And I feel like we could really reflect on how to do that differently and how to approach that differently and to support both sides of social protection design and delivery. And where I feel like we do tend to do it, or it does tend to happen, it's not in the empowerment space. It's not in having a seat at the table, as Nithya said, which is what it should be. It should be in that space. So I think a fundamental shift in how we approach partnering with a range of different actors in social protection delivery. The one other thing I'd throw in is we've talked a lot about evidence, and I think as a really critical part of that evidence base is the value for money and seeing social protection, gender responsive, particularly gender responsive social protection, as an investment that's worth making. Just like the care economy is an investment it's worth making. And that's a case that needs to be made to you know, to the economists, to the treasuries of countries that we work with. And it's that sort of evidence base that I think will be most powerful. I think I probably used up more than my 1 minute though.
No, thank you, Rupa. Great to see the alignment on this core message of prioritizing women at the head of the table continue, but also this point about making sure we're speaking in terms that are compelling to the people we're trying to persuade at all times. Andrew, last word to you.
Thanks. I mean, I agree with everything my fellow panelists have said, and maybe just I would phrase it in a different way, not because it's any better or worse, but just to give a different perspective on it. And that is to think about how best to localize a lot of our efforts, whether that's in terms of the knowledge generation and prioritizing knowledge generation that comes out of local contexts and is therefore more likely to be you know, better informed and speak to that qualitative aspect that was mentioned in the first panel today, or whether that refers to the kinds of voice and leadership around some of these issues in the places that we're all trying to support in addressing these things. So that would be my final point. But thanks very much.
Excellent. Thank you so much, Andrew, Rupa, Laura, Nithya, a fantastic way to round out the day. And I'm just going to transition, hopefully somewhat seamlessly, into our closing, which is to start by thanking all of our panelists across the day, the moderators, the presenters, our opening speakers, our events and IT teams behind the scenes who made today's virtual convening possible, the Bill and Melinda Gates Foundation for their support of our COVID-19 Gender and Development Initiative, and of course, all of you for taking the time to tune in today. As we close, I just want to offer a few reflections and start by saying that when we launched this initiative nearly a year ago now, we did so with two primary goals in mind. And the first was to try to increase the importance of gender equality on COVID response and recovery agendas. The second was to increase the use of rigorous evidence by decision makers as they seek to make COVID response and recovery more inclusive. And by listening to today's conversation, I think there are a number of reasons for optimism and some proof that in working in coordination with many of you as partners and allies, that we are at least part of the way to reaching these goals. As Ben Leo started us out by saying, and as a number of others have confirmed, in contrast to previous pandemics and economic crises, Zika, Ebola, et cetera, we have certainly seen that the evidence suggests more widespread awareness of the gendered impacts of COVID and the need to address them. And encouragingly, we've heard that directly from colleagues representing multilateral and bilateral donor agencies today. We've seen that in addition to researchers and advocates, these institutions themselves, represented by Pablo, Babatunde, Charlotte, Rupa, and Andrew, are generating their own data, and they're relying on the data and evidence being generated by outside researchers. And so now, of course, as we sort of shift from phase 1 to phase 2 of a sort, we need to make sure that the awareness of the problems associated with COVID as a gendered crisis, and also the good intentions to address them, ultimately translate into policies and investments that effectively reach and benefit women and girls equitably. So our team at CGD will continue to watch closely to hold these donor institutions accountable for achieving concrete results. But of course, we'll also work to continue to position the work that we do as a resource and in partnership to help guide decision-making going forward. And I think as each of the panelists during my last session reinforced, we and other partners and institutions listening need to be interrogating how we can be a bridge or an intermediary or a translator, reinforcing the messages, the needs, the constraints, and the experiences and expertise of local actors who know their context best. So we look forward to continuing to partner with many of you in this effort. And thank you so much for your time. Have a good rest of your day.